My name is Dr. Charles Shidlofsky. I'm a neurodevelopmental optometrist from Plano, Texas. My background is I've been in practice for 32 years and have worked in the neurodevelopmental field pretty much my entire career. Largely what we do in our practice, we work with patients who maybe have a developmental issue such as autism, ADD, ADHD, dyslexia. They may have strabismus or amblyopia or any other neurodevelopmental issue, and we work on improving their skills. We also work with traumatic and acquired brain injury, which can be a traumatic brain injury or a concussion, or perhaps you have a situation where you have a person who's had a stroke, and we'll work on rehabilitation of those skills. And in doing that, in both of those areas, we're really looking at re-establishing and redeveloping their visual skills that they lost due to their injury. Lastly, we also work with children who are developing nearsightedness to slow down the progression of nearsightedness. And also, I think realistically what we're trying to do is we do a lot of specialty contact lenses for those type of patients. I was introduced to visual snow with a lot of patient complaints over the years. Patients were telling me they're seeing almost like a staticky picture. And what ended up happening was we didn't really know what a formal diagnosis of visual snow was at that point in time, but we heard the complaint over and over again through many of our patients. So ultimately, what made me more aware of visual snow as a specific entity was when I was working with our patient Michael, who you'll meet later, and Michael had already had the diagnosis of visual snow. Someone had given him that diagnosis, and which led me to ask him a lot of different questions about the origin of that visual snow, when it happened, things like that. Later I became very aware of the Visual Snow Initiative, and what that allowed me to do is I got to read a lot of their research and really understood a lot more about the visual snow issues than I understood before. So I treated it largely as a symptom originally, but I really know it's part of a bigger overall problem. Well, largely, I had heard about symptoms from my patients over the years about similar types of staticky vision, spots in front of their vision, things of that nature, these different types of phenomena. And we always really treated them as if they had neurologic injury. So what we found typically is that if we took the proper approach in treatment, and that is kind of build the foundation for good stable vision, and then build the building blocks back up, we can redevelop their visual skills and eliminate a lot of their symptoms. So the way we really do this is we start off by working largely on what I call visual vestibular grounding, or that's balancing the visual system and the vestibular system. Then we strengthen each eye individually. Then we start bringing both eyes and work them together. Then ultimately we can work on perception and cognition to improve those skills. So really we didn't take any different approach than we would take for any type of neurological injury, yet we found that we had a patient who had visual snow type of symptoms. We were able to alleviate majority of their symptoms. As I started working more with Michael, who was my most recent patient, what we found out is he had probably the most severe symptoms that we saw, because it was really affecting everything that he did. So ultimately, I started researching visual snow a lot more at that point in time and started understanding some of the dynamics of visual snow. And it's really made me want to work more and help as many people as I can who have visual snow type symptoms.